speaking so we don't waste any time. So today we're going to speak about some multicultural issues. I want you to think of those things that would typically come up. So I always ask people to reflect. So as you're listening, I want you to reflect. I am going to ask for some open conversation at the end, but be open. And these are things you want to be open to now and throughout your practice. So what are some things that you have an internal bias to? If we assume that we are bias free, there's something wrong. Everybody has their biases. And we have these internal biases that we carry with us that could be influenced by where you were raised, who raised you, who your friends are, where you work, what you've seen and experienced in your life. And they do have an influence on your therapy and on who you are as a person. Another reflection is, what are the cultures of the students that I serve? So do I, I personally work in a majority Hispanic population, but I also have several Syrian refugees. I have some Afghani students. I have, a large African-American population. So looking at your population that you serve, and are you meeting their needs? Are you looking into their culture and not just yours? And then looking at your own culture and how does that influence you and your decisions and what you choose to do? So I apologize. It is not allowing Zoom to share, and I don't know how to change that. I'm in my security and privacy, and it's not changing. It won't let me select Zoom. Would it be better if I sent you the PowerPoint? I hate doing that, but
yes, please send.
I'm sorry. Let me send it to you right now.
Okay.
Should I send it through email? Is that easier?
Yes, that's fine. That's fine.
Okay, I'm going to put it in here. I apologize. I unfortunately, of course, 2 days before the school year started, my computer decided to die and have several issues and need repair. And I got a new one. And I checked everything except for accessibility on Zoom. So apparently I have to reset this setting as well. So I apologize.
That's okay.
And here we go. All right, I sent it. So hopefully you can get that. All right, you should have that. So I'm going to keep talking, and then once you get that, we're going to get on. So basically, we want to talk about what is diversity and inclusion. So in the state of New Jersey, and I'm not too particular about New York yet, I think it is being an ASHA directive starting 2023. We are now required to have 2 hours of diversity and inclusion, PD. So you have to have now professional development and diversity and inclusion, which I think is great because it's important. So what is diversity and inclusion? It is not a political movement. It's not a religious movement, not a minority only issue. It is for everyone. And it's not a human resources checklist. So it's not something we're just saying we're doing because we have to do it. Its purpose is empathy, community, and connectedness with each other. So when we look at it that way, it really is something that we should have in every aspect of our practice and what we do. What it is are programs, policies, and procedures that support all individuals from diverse cultures. We promote equal representation, regardless of a person's race, gender, religion, sexual orientation, or their disability. And the next slide is something that I actually want to show you. So I'm going to skip over that briefly and go into definitions, and we can go back. So just to go through some definitions, because we hear these terms a lot, and sometimes we feel that we know them. Oh, actually, yeah, if you can go next, and I'll tell you when to stop. Thank you so much for doing that. I apologize again.
Yeah, it's okay.
You can keep going. One more. There we go. So I love this picture because it really puts a visual. I love visuals, but it puts a visual on exactly what is equality and what is equity. So we're always talking about equality. And within the schools, they say we want everything to be equal, but equal is not always the best. Equality means I'm giving everybody the same thing, regardless of what they need. I'm not looking at their needs. I'm not looking at them as an individual. I'm just looking at giving everybody the same thing. So everybody in the class gets the same book, whether they can read it or not, doesn't matter because I'm giving them the same book. So that student that's visually impaired and needs a larger print, I'm not paying attention to that. I'm being equal and they all have the same book. But equity really looks at what does that individual need? What does each student in my classroom need? What does each student on my caseload really need to access the curriculum? So in here, it shows, everybody got a box. The student that didn't need the box got a better view, but he still sees. So it didn't really help him in any way. The little girl was the one that was helped. She's able to see and able to look over the fence now. And the student in the wheelchair, it actually sort of blocked their view because by putting a box in front of them, you took them further away from the fence, and it didn't help them in any way. But equity is giving each student what they exactly need. So giving that little girl a box so she can see fully without straining to see, giving that student with the wheelchair a ramp so now they can get to the top of the fence. And maybe that student who's already tall doesn't need help. Maybe that student that is accessing the curriculum fine and doesn't have any visual impairments or hearing impairments or learning disability, they don't need any extra assistance, and it's okay not to give them extra. So really looking at the difference between equality and equity. On the next slide here. And by the way, I do welcome any questions, introductions. If you have any thoughts, please speak up. I love it. So now looking at diversity, equity, and inclusion. So again, diversity asks, who's in the room? Who am I servicing? Who am I helping? What am I doing? Equity asks, who's not in the room, but trying to get into the room, and they can't.
Stop. You're not going to be allowed to play outside.
Sorry. So equity again asks, who's trying to get in the room, but they have accessibilities and they're not able to get in. And then inclusion asks,
stop.
Hey, I'm so sorry. Somebody's unmuted.
He just wants to play with them.
Play now. That's what
Yeah,
he's
but he
barking.
goes towards them.
Please mute.
I had to unmute myself though. Okay. So equity looks at who's trying to get into the room, but they can't get there. So somebody wants access and is not able to get it. So now I want that equity part. And inclusion takes it a step further and says, okay, everybody's in the room now, but has everybody's opinion and voice been heard? Have I really paid attention to who's in the room and given them a voice instead of just putting them in the room, but they're in the back or they're not being listened to? Am I really taking it that extra step? Next slide, please. So looking at some terms, because again, we hear these terms a lot, but we want to know exactly what they are. So dialect is the language that is specific to a certain region or group. So, a lot of people are, oh, they speak a different dialect. Everybody speaks a dialect. Your dialect is influenced by the region you're in, where you are. So, I'm a New Yorker. I moved, in the middle of high school to New Jersey, and they could tell, when I got angry, my R's disappeared. I had a different dialect going on with certain conversations. And then after years of living in New Jersey for a while, and then I came back to New York, now I have sort of a mixed dialect going on, and it does change sometimes by who I am around and who I'm talking to. Your dialect density is the quantification level. So when I first moved from New York to New Jersey, my New York dialect was much stronger, and then it got influenced as I was influenced by other dialects around me. Your dialectical differences are the regional and social variations that occur in spoken and written language. So these are the impacts on your language. And I think this is so important to know because a lot of times we confuse accent, dialect, and a disorder. And that actually was the topic of my doctoral dissertation, which I did speak to before with sisters, was knowing the difference between dialectical difference versus a speech disorder. And a lot of times it's a tough discrimination between the two, and knowing, is it really dialect or do they really have a disorder? And knowing the differences between the two. So many students are overdiagnosed and overclassified for just having a dialectical difference that we're not acknowledging. Next slide. So a dual language learner, somebody who is exposed to both languages since birth simultaneously. So at birth, I was exposed to Arabic and English within my house pretty equally. So I was a dual language learner. And I'm going to say I was, and I'm not bilingual, and I'll explain that in a little bit. An English language learner is a student that was maybe born in another country and came here. Your refugees, your students that moved from other countries. Or a lot of times we're getting our pre-K and kindergarten students that have been in a household that only spoke one language other than English. And this is their first exposure to English. So they are ELL. They are an English language learner student, even though they were born and raised in the US. So they usually require some supports to communicate and learn the English language. Limited English proficient are those who do not speak English as their primary language, but they do speak a little bit. They have some, but they might have a limited ability to speak, read, write, and or comprehend English. You can go to the next one. Mainstream American English is what you hear when you listen to the news station, the radio, 1010 Wins News, you turn it on. That's mainstream American English. So it's the primary dialect of North America. Non-mainstream English are when you get to more of those regional news stations, you know, New York One, or you get like certain, you know, more non-mainstream. And those are the secondary dialects that are spoken in North America, but influenced by region. So you can tell somebody who came from Boston because they have the you know, that R distortion and sound. So they're still speaking English, but they have a regional influence. And then again, like I said, speech sound disorders are actual errors in articulation and speech when there are physical difficulties present in a child's communication that keeps them from correct pronunciation, meaning even in their dialects and their dialectical speaking with their family and those that they know, there is still some error that is coming out. So I said before that, you know, I was a dual language learner at birth, but I am not bilingual. The reason for that is that as I got older, you know, my mom would speak to me in Arabic and I would respond in English, and English eventually turned into my primary language. I do speak Arabic, but I have an accent when I speak Arabic. So anybody who is a native Arabic speaker knows right away that I was not born in an Arabic speaking country. That, you know, I do read and write, but at a very limited level. I always say I'm like maybe kindergarten, first grade level when it comes to my reading and writing. So as far as being bilingual, I am not. And I say that because we have to be careful how we present ourselves. You know, a lot of times, you know, especially my district, they're like, oh, you speak Arabic, you can do a bilingual for this kid. I'm like, okay, what is their functioning level? If they're functioning at a lower level, if they're nonverbal and I'm just translating for the parent, if, you know, I'm looking at a pre-K entrance, then maybe, yes, I can do that. But once we're talking about a typically developing or maybe even slightly behind third, fourth, fifth grader, I am not qualified to look at their grammatical differences, to look at the errors in language in that dominant language of theirs. So again, we have to be okay with telling our supervisors no. It took me a long time to learn that word at work and to tell them, no, I can't do a bilingual, or I will do it, but within, you know, limitations. And I'm going to write that in the beginning of my report. And they didn't like that, but I had to stand firm because this is your license that you are representing and yourself that you're representing, and you never want to misrepresent. So we can go to the next slide here. So I borrowed this slide from a lovely woman that I did a presentation with. She has a website called Having Our Say. She is a phenomenal speaker, Shantae. If you ever get a chance, she's really wonderful. So one of her slides here that I took was knowing, you know, BIPOC. So we hear these terms, or we want to teach these terms to others, and we want to really know what they are. So what is BIPOC? It's Black, Indigenous, Person of Color. Marginalized are people who have been relegated to an unimportant or a powerless position within a society or group. So are our students being marginalized? Are you yourself as a professional being marginalized in your field? A lot of time in our sisters group, we hear these situations, we listen, we learn about them, where they feel like they've been marginalized within their work, even though, you know, sometimes a speech language therapist, it is a predominantly white female profession. So are you know, African-American, Arabic, Asian therapists feeling marginalized within that group of being a speech therapist? Racialized is the process by which people are categorized or defined by their race. So those preconceived notions, those misconceptions that come with, a certain race or society. Minoritized are culturally, ethically, or racially distinct group that has been defined as minorities by a dominant group. So in my district, again, it's a primarily Hispanic, district. So sometimes those that are not Hispanic, so my African American students or my Arabic students feel like they are a minority within their own school. So again, looking at that and making sure we are cognizant of it. If you can go to the next slide, please. So why do we use functional assessment components? There's so many reasons, but I'm going to focus a little more on, the multicultural aspect of it. So of course, we want to gain information on developmental history. Like I said, just because a student was born and raised in the US doesn't mean English is their dominant language. Just because their parents are Hispanic doesn't mean they speak Spanish. Are we looking at who their caregiver is? Sometimes the parent and the caregiver are two different people. So a lot of times, yes, mom and dad speak English fluently, but they're not the ones watching the child. Grandma is, and grandma may only speak Spanish. Sometimes, I had a Spanish family where everybody assumed the student needed a bilingual Spanish evaluation. And when I was testing, and, getting some translation and things, I was like, wait a second, there's another language here. And I found out that their caregiver was actually their nanny who spoke Polish, and sometimes would speak Polish around the student, and that influenced their language a little bit. So are we looking at all of those aspects and asking those questions? Who is really with this child most of the time, and who is influencing their language? Is mom from Dominican Republic and dad from Puerto Rico? So there are two different Spanish dialects going on in the household, and how is that influencing? It can occur in various settings. So we're seeing this kid in a more naturalistic setting. Are you just taking the student out and into your office or into a room and testing them one-on-one? Or are you looking at how they're influenced and how their language is influenced when they're talking to their teacher versus when they're talking to their friends on the playground? Are you going out on the playground or in the cafeteria and listening to how they talk with their friends, and those secondary aspects of language and how that changes as well? So by doing this, we help to avoid stereotyping and putting our kids in a box. And it allows therapists to rule out other causes and other issues that might be going on. You can go to the next slide here. So looking at our assessment results, we take our assessment results and we use them to determine eligibility and services. They help us to set our intervention goals. They help us decide determinations for ESL versus bilingual classes versus not getting anything at all. And it helps us give recommendations to others. So when we get our assessment results, are we just using numbers on standardized assessments, or are we taking that functional piece into consideration and looking at how it really can influence that child and what they should be getting? You can go to the next slide now. Making appropriate clinical decisions is crucial. When children are not assessed or they are assessed incorrectly, it could provide, can result in an inappropriate provision or denial of services. So are we doing right by our kids and giving them the services that they need? Or are we over-servicing kids that don't need that and maybe need ESL or maybe need counseling or need something else? So it helps us look, some considerations we need to look into when we're looking at our assessment results. Are differences in sound repertoire between their languages? Are they having that, our difficulty in Spanish and English, or is it only in Spanish? Where they have that English influence now in their language and they maybe don't have that trilled R. Look at their age of exposure. Did they, were they exposed to that language prior to the age of 5, when we know that's such a crucial time and that influences accent and everything else? Or were they exposed later at an older age when they're already a school student and already taking classes? And then the silent period. So many people don't know what the silent period is. So I get a lot of referrals. I don't know if you do too as well, from, that kid that came new to the school, maybe came from a different country, a different area, and they're in that silent period. And then the teacher doesn't realize, and they're like, oh, this kid is selective mute, or they're nonverbal. There's something really wrong with them. I need you to, they need to be special ed, or I need you to check out this kid. And a lot of times they're really just in what we call a silent period. So again, a student who was predominantly exposed to one language, and they're now being exposed to a new language or a new class, or sometimes it's the same language, but a new situation, which is making them very shy, very nervous. And they, maybe don't have that, that help that they need, and are looking into getting that. You can go to the next slide. So on ASHA's website, they actually have this cultural competence checklist. We don't say cultural competence anymore. We now are going towards cultural humility and cultural identification. So this shift is happening newly, and you, oh yeah. So you recently learned about the silent period, and I'm so glad that you did. And I was surprised because, again, I'm so involved with multicultural issues, and it's something that a term that I've heard for so long. But when I presented on this topic before, I was surprised that so many people did not know what the silent period is. And again, these students were being referred or being taken on. And to give you a quick example, so I had a student, she was a Syrian refugee, just came to the country, had never been in school. She was starting kindergarten here. She had CP, she did have some cognitive impairment. And the automatic assumption was that she's nonverbal. She can't express herself. She has issues, and mom was saying, no, she speaks at home a little bit. And they're like, oh, mom is, just determined that maybe she has more skills than she does, and this and that. But, watching her in the class, seeing her interact with her peers, I noticed, I'm like, no, there's something different. She's talking a little more. She's, she's starting to look at students. She's laughing at jokes. And I see her like mumbled things here and there, and it was changing. So I asked mom to record her at home. I said, can you record her and let me know, how she does at home? And sure enough, she was a little chatterbox at home. Maybe not a ton, but she did have some language, some things going on. And after, I want to say, a good 2 months, she had a long period, but after 2 months, she had absorbed everything around her and taken in the class and become comfortable. And suddenly now she became that little chatterbox in the classroom. And she actually became, we used to call her the assistant teacher, because she thought she was the teacher for the other kids and wanting to tell them what to do and how to do it. So it's very crucial to know what the silent period is. So here, again, the shift between cultural competence now, we no longer look at ourselves as being competent, because if you look at yourself as being competent, there's no room for improvement. And it means we reach the highest level. And there's always room to improve when it comes to culture. However, I do like this checklist. And it's a good way to check yourself. So look at what you're doing and how you're doing it. Look at your influence that you're having. Are you really taking into consideration religion, faith, gender roles, education? Do you look at your own influences and how it may influence your therapy? Are you looking at child rearing practices in the house that are influenced by culture? Do you know the difference between a disability and a communication difference? So it's a good way, again, just to take a step back, look at yourself, see where you fall on this checklist. There is no right or wrong. It's a rating between strongly agree and strongly disagree, and look at yourself and see where your areas of improvement are. You can go to the next slide. But like I said, I feel like it's so important to look at ourselves. And again, why does it matter? Almost 30% of the United States population identifies as a racial minority, and these numbers are growing every year. This was as of 2010. Right now, I believe it's at about 33, 34%, but we are largely climbing. Racial minorities are not going to be the minority anymore. So we need to take in every student as a consideration. You can go to the next slide. The identity wheel is another great way to check yourself and look into yourself and where do you fall and how do you identify with yourself. So are we looking at our own race and ethnicity and how it influences our work experience? So where you work largely influences how you look at students and what culture you're exposed to. your own family and the biases within your family and your family influence on you, your political beliefs and how they impact your decisions. Language and your communication skills, your own, and checking your students' language and communication skills and how that can identify their identity and how they see themselves. You know, your appearance. Is appearance important to you? Is it not? How do you present yourself? I dress very differently at work than I do when I'm going out with my friends, than I do when I'm going to a soccer match for one of my kids. And that is part of my identity. My soccer mom identity is very different than my speech therapist identity versus my, you know, mother identity or wife, or looking at all those aspects of yourself and how does that influence your decisions at all times. You can go to the next slide here. So some considerations that we want to make are asking students, you know, don't just pronounce their name and call them by what you think their name is. Ask them how to pronounce their name and what they would prefer to be called. Are you taking in gender considerations and looking at, you know, pronouns and what they want to be referred to as? Are you taking in religious consideration and how that might impact? Food restrictions and holidays and days off and things like that. Are you looking into this? Religious considerations, looking into, again, those influences that it can have, family considerations and influences that family have. So for some families, you know, education is important and it's crucial and it's a huge part of their identity and their family. And for other cultures, you know, maybe education is not important. Maybe, you know, being a good person or speaking a certain way is more important to them. Maybe just getting by is okay. And that was hard for me because for me, I was raised in a family where, you know, education is crucial. There's no such thing as you have to be educated, you have to be highly educated. And I had that push growing up. And you know, a lot of people around me were in that same field, in that same level and same push. And one of my students, you know, was really struggling. And the dad sat with me at a meeting and just literally said, you know what? He's happy now. And I noticed that he's able to talk with his friends and he's making friends now. And he wasn't able to before. And the dad was really happy. And to him, that was a priority. And he said, you know what? He's not a bright kid. He's not going to go to college. I'm okay with that. I want him to be able to have friends and to be able to participate with family members at a family gathering. And that to him, the kid's goals were met. So are we looking into those considerations and how it's going to impact our therapy decisions? You can go to the next slide, please. So this is such an important quote here. And it says, when children cannot find themselves reflected in books they read, the images they see are distorted, negative, or laughable, they learn a powerful lesson about how they are devalued in the society of which they are a part. So are you showing students themselves reflected in your therapy choices, in your books, in your materials? And on the next few slides, we're going to start talking about how to influence that into your decision making. So the benefits of doing that, you get increased engagement from these students, and a sense of belonging, and a greater willingness to participate and continue with therapy. So when they feel like you respect their voice and respect them individually, they will respect you more and they want to participate more in your therapy. So next, on the next slide, we're going to look at some consideration for materials. So the noise here, I actually had my son grab the bag for me because I had left it over there. So I just grabbed some books off my shelf at work. I have a lot of different therapy books. And I always make sure that everybody's identity is reflected. So again, I just grabbed a few, but I just wanted to share with you a few of the books that I have. And I'm in a pre-K to 8 school, so I have all kinds of books. So first, the speaker that I told you I spoke with, Shantae, this is actually her book that she wrote. And she goes by the pen name of Tay Jones, and it's Liam's First Cut. And it's a story. It's not only about a young African-American boy, but he is autistic, and going for his first haircut, and talking about that neurodiversity and that different child. And, you know, he goes to the barber shop and, you know, it's an African-American barber shop, and just showing that influence, and letting kids see that. I have The Princess Who Lost Her Hair. And this is more of an African legend, and showing some students that level. Getting books that have all students pictured and is by an African American author, but all students are shown in here at all levels and playing and with each other and, you know, participating in play, and we're all equal. Probably still my favorite book, The Snowy Day. Just absolutely love it, by Ezra Jack Keats. They actually made stamps last year and a couple years ago, and I ran and collected them. One of my favorites to have. And again, just such a simple book about a boy enjoying a snowy day, but he's an African American boy, and looking at how we can show that as well. I have a lot of these Who Was books, and I do get different ones. So you know, Who Was Frida Kahlo, and looking at, you know, some Hispanic influence, because I do work in that population a lot. This book is a new one that I just got added, and actually was a gift from one of my teachers, because she knows that I collect all these books, and I love that she gave it to me. And it's called Just Ask. Be different, be brave, be you. And it's about being confident with yourself, no matter what your level. And I mean, even if you just look at this inside page, there's a child in a wheelchair, there's an Asian girl, there's a girl with goggle glasses because she needs those, a boy with a yarmulke on his head. You know, just looking at all different types of students, and you know, do you ever need to take medicine to be healthy? Do you know, I love reading and writing. How about you? Do you ever wonder if people understand you? And just looking at all of our students and letting them all know that they have a voice and they're equally important. I also brought one of my dollies. So, you know, I have a little, this is my little dark-skinned dolly. I have different shades. I have a doll that actually right now she's in a classroom because I have a lot of students with Down syndrome, and she's a Down syndrome doll. So she does have the facial affect for Downs. But it actually made one of my students really happy to see a doll that looked like her, and it's been helping to comfort her in the class. She's a new student. One example, at the end of the year. So I have all these inclusive dolls and inclusive Barbies and different, you know, genders and races and things. But so I had an African, and I say I had because I no longer have her. I have to get a new one, but I had an African American doll that was in a wheelchair. It's a, you know, it is a Barbie doll. And she was in a wheelchair. And it so happens there is a student in my school. She does not get speech. The girl does not need it. She is more than talkative enough, and can express herself 1,000%. And she is African American and in a wheelchair. And one of the days at the end of the school year, the elevator wasn't working, so she wasn't able to get up to the second floor. Hanging out in the child study team office, and asked if she can hang out in my room for a little bit and chat with me. And I said, absolutely. And as she was chatting with me, she turned and saw this doll on the shelf and got silent. I've never seen this girl go silent. And she's like, can I see that? Can I touch her? And I said, absolutely. And I gave it to her. And the doll is wearing like this cute little, you know, skirt outfit. And she's like, talk about representation. And she literally, this is what this little girl tells to me. And I was like, why do you feel like it, you know, it represents somebody in here? And she's like, damn straight. She's like, this is me, you know, in a doll. She's like, I never thought there'd be a doll that looked like me. She's like, even her hair is on point. She was so excited about this little doll, played with for the next half hour. They got the elevator working. She was leaving, and I could see her actually being sad putting the doll down. And that's why I say I no longer have the doll, because I asked her if she wanted it. The girl was in tears. She started crying and said, absolutely, I want her, because it's the first time I've ever seen a doll that was me. And that really brought it home, because I thought about that, and I do try to put it in my practice. But when you see it reflected in a kid's eyes and a kid's words, it drives the idea home, and it lets you know that you're doing the right thing. So again, how could you easily adapt your current materials to be more inclusive? You're already using books, use inclusive books. You're already using dolls, use inclusive dolls. Let's get different cultures. Let's not just celebrate, Christmas and, Rosh Hashanah is coming up and we have a day off. Do we know why? Do you know that that's Jewish New Year, and that, let's celebrate those students that celebrate it. Let's look at Kwanzaa. Let's look at Ramadan, that's now being given as a day off in the schools, but the kids don't know why, and they don't know what it stands for. So are we celebrating everybody within the school? You can go to the next slide, please. I'm just going to take a sip here. So again, I do feeding and swallowing therapy. So looking at some considerations for the student. So restrictions in diet due to religion or culture. Looking at, Hindus don't eat beef. Muslims don't eat pork. Looking at different influences that you would have on your feeding. So again, are you giving them Jello pudding because they're on, I said not the pudding, actual Jello. Jello has pork in it. You have to get other companies or brands that don't have pork in them. Up until about a year ago, Doritos chips had pork in the seasoning. And are we looking at that and paying attention to those things? A lot of times around winter, they love doing Holiday Express, and they do hot cocoa in the classrooms, and they get the mini marshmallows. I'm like, did you get kosher or halal ones that everybody can have? And a lot of teachers forget that part. So those kids are excluded and can't have it. So it doesn't just have to be during therapy, but are we taking these considerations for everything that we do? Some students use utensils, some don't. Moroccan culture, certain cultures, they grab their rice and they eat it by hand. Is that something that we're faulting them for? Or we know that they don't have a feeding disorder, they don't have an OT issue, that's just how they eat. And I put seasoning on here because, again, I have a student who's Afghani, who I do feeding therapy with, and he was on, a liquid only diet when I started with him. Now he's up to mixed chop. And he was not liking any of the food at school that we were giving him. And, school food tends to be a little bland. And the first day that he really was excited about the food was when we had a Jamaican patty. And he could only have the ground beef that was inside, but he loved it. And I realized, I was like, and I throw seasoning on my food. I put a lot of seasoning. I'm not just a plain salt and pepper person. I love to throw lots of seasoning in there. And I was like, I didn't even pay attention to the fact that Afghani food is loaded with spices and seasonings. So I started bringing in seasonings. I asked mom if it was okay, and I started shaking some seasonings on his things, and it improved his therapy tenfold. So are we taking these things into consideration? On the next slide, we're going to look at a little bit more on feeding. So looking at, you can go, beliefs and practices about feeding. So again, some cultures, they don't care how the food gets in there as long as that kid is fed. The priorities, my kid needs to eat. Eating is a priority. It's huge. I need them to be fed. Other cultures, my kid's getting too fat. I don't like this, and looking at what is healthy eating and what is not, and making sure they're on board with the nutritionist and everything else, and feeding the kid appropriately, and making sure they are getting enough nutrition and enough in their diet. And then again, like I said, looking at caregiver culture may be different than the client's culture, and making sure we're taking in that influence, and looking at, are we looking at, family focused care? Are we looking at the carryover into the home? And what am I doing in the session that is going to be taken home and done as well? Or is it just going to be all for naught? And once they leave me for that 30, 45 minutes, whatever session I do, and then it's over with. You can go to the next slide here. We're looking at, there is a strong relationship between culture and food. There's different reflections and beliefs in feeding, making sure we're representing all cultures, and economic status and its impact on food. Not every student is, exposed to all different types of food. In my school, we were blessed to have, now the last few years, we have a fruit and vegetable grant that, 2 to 3 times a week, we get a different fruit or vegetable that is served to students as like a snack at the end of the day. And sometimes it's a regular one, like it's a tomato or it's a cucumber or something normal, and apple slices. And sometimes it's star fruit or it's pomegranate. And some of these kids, this is their first time ever seeing those fruits. It's a guava and they don't know what a guava is. Or looking at different things that maybe they're not exposed to because these foods are maybe not within their culture, or they're expensive and not within their budget. So looking at that influence as well. On the next slide here, we're looking at augmentative and alternative communication. So are you looking at, some parents, again, they see AAC as, I failed my child, and they don't want to use that device, or they don't want to use PECS, or they don't want to use sign because they feel like it's cutting me off from my kid, or it's maybe not culturally accepted within their culture. So looking at their beliefs and how, using a low tech versus a high tech device might help, looking at those considerations for carryover and generalization into the home, allowing the caregiver and client to be proud and build on their language. And we have to pay attention to the fact that it's great that little, Bob can, influence, he's using a PEX system and it's great and he's doing great in the classroom. But when he goes home, looking at, is the parent speaking that same language too? Can they use it with them? Are we putting PEX symbols that are, able to be understood? Are we writing it in their language and, English? Or are we just having it in English? Are we picking AAC pictures that are, the student's African-American? And so many times, I'll see the therapist made a PEX board that it's all white. Or they're a boy and we're using, pictures that are of a girl. Or I love when we're programming devices. And obviously, I identify as female and I use a female voice. So I'm not going to record an AAC device for a student who is male. And if they're male and African-American, I try to find a male who's African-American to record that device. Because again, that dialectical difference, that influence, that impact, let that child's voice be heard in their head. And when they do speak, sometimes they identify within that dialect they hear in their household. And again, are we using that on their devices and taking that into consideration? Next slide, please. So again, cultural background can impact the skin color selection, word selection, accents, clothing, play items, holidays they celebrate. So when you make that holiday page on a PEX board, are you including their holidays or just the ones that are celebrated in school? Looking at the play items that they use within their house. Some homes, they might use a drum set and another house might use bongos. So what picture are we using and choosing? And again, that accent influence on there. And skin color, I always want to tell people it's not black and white. I'm in the middle. I tend to, I'm a little more tan. My shade is never there, and it's so hard and to find. So again, like even looking at crayons, I love the Crayola crayons. The shade of every skin color now, and I love that we can use them in therapy. And I have my kids, and now they color their picture, and they're so excited to find a crayon or a marker that has their skin tone. So remembering that there's so many different shades in between. You can go to the next slide. So again, considerations incorporate diverse pictures, a variety of vocabulary. You can go to the next slide. We spoke about this. Cultural humility. So there's a little video here. I'm not going to play it for the sake of time, but I did leave the link in here because I think it's a 2-minute video. It's really great just to watch and understand what cultural humility is. Because again, this is the new shift in terminology. It is basically what we've been doing it, but taking it to another level, taking that thought process of cultural competence. I can't be competent, but I can have cultural humility. So that's a good thing to look into, especially, like I said, as we're looking into those new professional development hours that are required in DEI. You can go to the next slide, please. So I like this little part. I call it get comfortable being uncomfortable. So this is where I want you to talk. I want you to share with me some experiences that you might have had either with your students, with your coworkers, what has influenced you? So if you go to the next slide here, the last slide, communication variables. So I use my hands a lot. You probably saw my hands popping up and down. That is a cultural thing. We speak with our hands. We tend to be very loud. I tend to speak a little faster. Sometimes people need to tell me to slow down a bit. So that is a cultural influence that I have. Some people are good with silence, and talking too much is, inundating for them. Looking at turn taking, looking at greetings. So I'm going to give an example here. How many of you love to give a thumbs up? Thumbs up if you hear me, thumbs up if it's good. Did you know that giving a thumbs up sometimes in some Middle Eastern cultures is the equivalent to giving the middle finger? So maybe it's not a good thing. Looking at, some people use a peace sign, peace. But in some countries, when you look at the peace sign in Australia or South Africa, it actually is the same as saying up yours, and you're cursing out somebody. So these are some influences of cultural variables.